Inhaled nitric oxide can improve oxygenation in patients with severe hypoxemia. At high concentrations, nitric oxide displays broad antimicrobial effects. Several trials are testing the effect of nitric oxide on COVID-19.
To date, there is no device available that is able to administer inhaled nitric oxide at concentrations higher than 80 parts per million without the need for dedicated, heavy, and costly equipment. This device will allow for high-dose inhaled nitric oxide to be delivered outside the hospital setting. Patients with lung colonization due to multi-resistance bacteria, like cystic fibrosis patients, will be able to benefit from this treatment.
Demonstrating the procedure will be Stefano Gianni and Bijan Fakhr, two postdoc research fellows from my laboratory.
To set up the patient interface, connect the built-in elbow port of a snug-fitting, standard, non-invasive ventilation face mask of the appropriate size for the subject to a high-efficiency particulate air filter through the 22 mm outer diameter, 15 mm inner diameter connector. To build a Y-piece, use two opposite-sense, low-resistance 22 mm male-female one-way valves to create expiratory and inspiratory limbs on the two distal ends of a 22 mm to 22 mm and 15 French Y-piece connector with 7.6 mm ports. Position the one-way valve connector to the expiratory limb with the arrow pointing downward to allow a proximal to distal flow only, and position the connector for the inspiratory limb with the arrow pointing upward to allow a distal to proximal flow only. Then use a 15 to 22 mm two-step adapter to attach